Dental Office Emergency Case Study Project, Epileptic Seizure by Nicole Green with Roseanne and Dallas. Patient arrives and states they feel the beginning of a migraine headache may be starting, but wants to get their teeth cleaned because they have a big social event that weekend. Patient stated in their medical history of having epileptic seizures in the past, but has been taking their medication on a regular basis and has not had an episode in years. The hygienist proceeds to clean their teeth, and within 10 minutes, the patient goes into a tonic-clonic seizure. Patient stated in their medical history of having epileptic seizures in the past, but has been taking their medication on a regular basis and has not had an episode in years. The hygienist takes the patient's vitals and proceeds to clean the patient's teeth. Epileptic seizures is a group of disorders that involve chronic, recurrent attacks of involuntary behavior or changes in neurological function, with each episode classified as a seizure. 4 stages are oral or prodromal, preictal, ectal, which has 3 phases, tonic, hypertonic, and clonic. Final stage is post-seizure or postical. Types of seizures are partial, generalized tonic-clonic or grand mal, absence or petit mal, and generalized seizures. The patient notices an aura.
Something smells really sour in here.
The clinician notices a symptom as mood changes.
Oh my gosh, no, stop. That's really painful.
Are you okay?
Yeah, well, I don't know.
Within 10 minutes into the cleaning, the patient loses consciousness, starts having total contraction of muscles, hyperextension of the spine, convulsions, heavy labored breathing, a seizure.
Dennis, are you okay?
The clinician keeps the patient still and out of harm's way while yelling, "Medical emergency, call EMS."
There is a medical emergency, call 911.
Treatment options are to protect the patient before, during, and after the seizure, move everything away from the patient, have patient supine, chair lowered, keep patient from falling, time the seizure, give oxygen at 6 to 8 liters per minute, monitor vitals, and provide the cabs of life support if needed, all while EMS is on the way. Preventive procedures are to schedule early morning appointments after the patient has eaten and within a few hours of taking their meds. Explain to the patient beforehand how important it is they let the clinician know immediately if a seizure is impending. There should also be further discussion while reviewing the medical history. The definition of an epileptic seizure is a group of disorders that involve chronic, recurrent attacks of involuntary behavior or changes in neurological function. A tonic-clonic seizure have a specific sequence of events ranging from the warning phase to recovery. 4 stages. The first stage is the aura or prodromal phase, considered to be a simple partial seizure, subjective sensation that precedes seizure activity. Stage 2 is the preictal phase. The person will lose consciousness and may fall if standing. The third stage, or ectal phase, has 3 phases. The tonic phase is when muscles have sustained contraction, so the patient may produce a loud cry due to tight muscles of the chest, lungs, and vocal cords. Hypertonic phase, the patient experiences extreme muscle rigidity, including hyperextension of the spine. Clonic phase, the patient experiences muscular contraction or spasms and relaxation, often accompanied by heavy labored breathing. The fourth and final stage is the post-seizure or post-ictal phase, is when the movement has stopped but the patient remains unconscious. This stage may last for minutes to several hours. Types of seizures. Partial seizures, simple and complex. Generalized tonic-clonic seizures or grand mal seizures, absence or petit mal seizures, and generalized seizures. Signs and symptoms: aura, mood changes, loss of consciousness, total contraction of muscles, hyperextension of the spine, convulsions, heavy labored breathing, clenched jaw, and fourth of the mouth. Preventive procedures: Optimal times are early morning appointments after the patient has the in within a few hours of taking their anti-seizure medication. Discuss with the patient the importance of letting the clinician know immediately if a seizure is impending. Further discussion during medical history is needed. Treatment options. At first indication, all dental treatment must stop and any source of injury must be moved away from the patient. Time the initiation of the seizure. Contact EMS if patient doesn't have history of seizures or is a well-controlled epileptic. Tight clothing may be loosed and patient placed in supine position. If in dental chair, lower the chair and keep the patient from falling. Time the seizure. If longer than 3 minutes or patient becomes kyonic from the onset, EMS should be contacted. Oxygen should be provided at 6 to 8 liters per minute. Cabs of life support provided if needed, and vital signs should be monitored.